New research released by the PATH Partnership shows high levels of poor mental health experienced by new parents during pregnancy or within the first year after birth. This low mental health rate is exacerbated by a lack of confidence to reach out for support due to social stigma of looking like a bad parent. Well, these experiences were also made worse by the pandemic, with new parents feeling extra anxious due to attending appointments alone, not being able to reach doctors, and in some cases having to give birth alone.
We're here to tell us more about the effects of perinatal mental illness, or what's called PMI, on new parents is Dr. Bosky Nair, consultant psychiatrist at Kent and Medway NHS, and also Joanne Harrison, a case support worker. Joanne, let's start with you. What kind of scenarios are people coming to you with?
Well, like you said, a lot of the mothers at the moment have had a really tough time over the pandemic, not being able to have their partners with them whilst giving birth. It's a very scary time, and you know, they need that support. I'd say that was probably one of the biggest issues. And then once they're home, the isolation away from other members of their family.
And talk us through the experiences through the pandemic. What were the specific problems with that?
Just not being able to have, just the lack of support, not being able to have that support of, you know, family coming to visit, and also have, you know, not having a partner there at the birth.
Dr. Bosky, what kind of problems does this cause, obviously, for the health of the mother, but also for their children as well?
I think the problem is enormous. What we know from research is that the problem is not necessarily, affecting mothers, but also the child in terms of developmental outcomes, as well as the wider family and society. We've had research over the past 10 years or so showing that the economic costs of perinatal mental illness is quite significant. It amounts to 8.1 million in a year. So, we certainly need to tackle this problem and try and address these issues urgently.
Come up with a figure like 8 million. Is that through loss of work time? I mean, where does that come from?
So majority of the costs are associated with the impact on children. So we are talking about loss of income, the loss of productivity, and, the impact that mental illness can have on society in terms of workforce and in terms of every section of society, really. So, health sector, criminal justice system, the impact is enormous.
Thank you both for speaking to us, Dr. Bosky Nair and also Joanne Harrison, a case support worker. Really appreciate both of your time this morning.